plaque and calculus. Bleeding on probing, that is the main identification point for the gingivitis. Okay, so how to do diagnosis bleeding on probing? There will be 3 grading. Number 1, I think you all know how to do the bleeding on probing examination. Okay, so depending on that grading, you have to hold the periodontal probe, and you have to insert the tip of the periodontal probe within the gingival sulcus distally. Then from distal to medially you have to draw, and you have to wait for 30 seconds. Okay, so if there is within 30 seconds there is no bleeding, then bleeding on probing grade will be absent. If there is bleeding within 30 seconds little amount, then it will be bleeding on probing presence. If there is after draw spontaneously there is bleeding, vigorously there is bleeding, then it will be bleeding on probing spontaneous. Depending on that grading, your diagnosis will be 3 types: plaque-induced mild gingivitis, plaque-induced chronic moderate gingivitis, and plaque-induced chronic severe gingivitis. Okay, there will be associated plaque and calculus. Okay, then if that patient remain untreated, then it will convert into periodontitis. How to do diagnosis periodontitis? Depending on the plaque and calculus, there will be plaque and calculus present. But the main feature is there will be pocket depth, true pocket formation, more than 3 mm. If there is pocket, then it will be diagnosis as periodontitis. If there is gingival recession, this pocket will turn into clinical attachment loss. Okay. If there is normal periodontitis, either plaque-induced normal adult periodontitis, usually there will be pocket depth. But in case of periodontitis, if you get gingival recession, then there will be clinical attachment loss. Okay, and there are also some grading. I think you know the grading. So depending on that grading, your periodontitis will be diagnosed as plaque-induced chronic mild periodontitis, moderate periodontitis, or advanced periodontitis. So these classifications are known as clinical classification of the periodontitis. Okay, so clinically this periodontitis could be classified into mild, moderate, and advanced or severe. Okay, as well as there will be associated features. There may be some associated features, like there will be tooth mobility, like there will be percussion involvement. Okay, usually in case of periodontitis, we could get this type of feature, extra feature. So what are the common feature of periodontitis? Number 1 is pocket or clinical attachment loss. Number 2, there will be percussion involvement. Number 3, tooth mobility. Number 4, there could be gingival recession. Okay, do you understand? If there is gingival recession, definitely it will be periodontitis. Okay, junctional epithelium as migrate typically in case of periodontitis or gingival recession. That's why it will be diagnosis as periodontitis if there is gingival recession. Do you understand? So by this way we will diagnosis it is periodontitis, or whether it is periodontitis or gingivitis. Depending on your diagnosis, the treatment plan will be, if there is gingivitis, so the treatment plan will be scaling and polishing and follow, and oral hygiene instruction for treatment. Okay, scaling, polishing, oral hygiene instruction, and follow. But in case of periodontitis, the treatment plan will be added some extra treatment plan, that is scaling, polishing, then root planning. Why root planning will be come here in case of periodontitis? Because gingival recession, or as there is a pocket. But in case of pocket, junctional epithelium migrate typically, so that's why the root will be exposed. Okay, that's why you have to do root planning. Clear?
Yes.
Okay. So in case of periodontitis, the treatment will be scaling, polishing, root planning, then oral hygiene instruction, then follow. You understand? Okay. If it is not corrected, then you have to do the periodontal surgery. Okay, I think you know that periodontal surgery. Okay. So the basic treatment is scaling. So how you have to do the scaling? There is a definite technique. So we want to teach you regarding this scaling procedure, and you have to maintain some system to do the scaling. Number 1, you need some instrument, okay, to do the scaling. So the number 1 instrument is the dental mirror. To hold this in the left hand, and number 2 is hand scale, okay, initial or ultrasonic scaling tip. So these two instruments are important to do the scaling. Okay. So first thing that how you have to hold this instrument. There are basically different techniques, but you have to follow the two techniques. One is pen grip method and another one is modified pen grip method. What is pen grip method? Each instrument has one body, another is operative end, and body and operative end in between there is a portion that is known as shaft. Okay, so every instrument has body, shaft and operative area. Okay, so you have to hold these instrument by your two finger, thumb finger and index finger like that on the body. Okay, or just joining in between shaft and body. So you have to hold this instrument by these two fingers. Okay, then that is the third finger or middle finger. If you touch on the shaft over there like this way, that is the pen grip method. Do you understand? That is the pen grip method. If you just change the position of the third finger just below to the shaft like this way, then it will be termed as modified pen grip method. So you have to hold this instrument either the pen grip method or modified pen grip method. So you have to hold this instrument like that. If you touch here, that is the pen grip method. If you just go downward, then it will be modified pen grip method. Clear? Do you understand? So that is the first procedure to hold or to take the instrument. Okay. Number two, operator position. I am the operator or doctor position. So this doctor position could be two types. We could classify the position of the operator in two categories. Number one, we could divide our position depending on the side. Like I am now situated or standing backside, totally backside. So that is the operator position. One is backside. That is the lateral side. Lateral side. Okay. That is the in front side. Okay. So operator position could be either in front or side, lateral side, or the back side. Okay, in front, side, and back. That could be the operator position. Or the position of the operator could be classified depending on the clockwise. Okay, like if I am just standing over there, then it will be 6. So that is my position is 6. That is 12. So that is the 6 position. If I stand here, that is 6.
7.
So that is the 6. But if I hold here,
7.
then it will be 7. If I stand like
9.
here, 12, I'm here, so it will be 9 o'clock. Then 10, 11, I think you could understand. Okay, so now that position is 11 o'clock position. And if I stand here, 12 o'clock position. Do you understand? That is the most standard position of the operator. 12 o'clock position, 11 o'clock position, 9 o'clock, 7 o'clock, 6 o'clock. Do you understand? Okay, so that operator position is the clockwise position. Finish, then the patient position. That is second one. You have to maintain these things to do the scaling. Okay, so what will be the patient position? Always the mouth cavity or the jaw will remain below the elbow of the operator. Okay, so patient's mouth or jaw will remain all time below or adjacent to the elbow of the operator. That's the first criteria. Number 2, patient will be supine, not in a seated condition. It will be supine position. Okay. So okay, তাহলে নাম কি বললাম আমরা, সেটা হচ্ছে পেশেন্ট পজিশন উইল বি সুপাইন পজিশন. Number 2, patient's oral cavity will remain below the elbow point. Number 3, in case of pregnant women, the position will be changed, either right lateral or left lateral. Why? Because if there is pregnancy, there will be child in the abdomen, and if that pregnant woman remain in a supine position, that child will give the pressure over the infravenously, okay, infravenously and abdominal. Okay. So that child will give the pressure, then there will be less blood supply to the leg and less blood supply to the heart. Okay, do you understand? Do you understand? Okay, if there is pregnant woman, due to pregnancy, the child will give the pressure over the infravena cava and abdominal cavity. So there will be circulatory problems. Okay, and patient will go under pain. Okay, that's why in case of pregnant woman, you have to shift the position, either right side or left side. Then there will be no pressure on the artery. Do you understand?
Yes.
Okay. If patient becomes pain, then the position should be changed. You have to alter the head downward and you have to raise the leg upward. Okay. That position is known as 10 Dillenberg position.
10 Dillenberg position.
Okay, 10 Dillenberg position. When any patient goes to the shop, then you have to bend the leg downward and you have to raise the leg upward. Okay, so that the blood circulation will again reach to the brain. So this position is known as 10 Dillenberg position. 10 Dillenberg position. These are the patient position. Clear? Okay, now the third point, that is the retraction. Okay, you have to retract out by the mirror. So retraction is done by mirror. Number one. Number two, what things you have to retract? What are the structure you have to retract? You have to retract the cheek. You need to retract the cheek to do the scaling. You need to retract the lips and you need to retract the tongue. So three structure you have to retract. One is cheek, lip, and tongue. Okay, you could retract the cheek, tongue, and lip either by dental mirror or by finger. Okay, so you could retract the cheek, lip, and tongue either by dental mirror or by finger. That is the retraction technique. Clear? Okay. So how could you retract these things? So before that retraction, you have to insert this mirror. You have to insert this mirror. If you want to retract the cheek or lip by that mirror, you have to insert this mirror within the oral cavity. You have to insert this like that. Open your mouth. That mirror position will be like this way. Okay, not like that. Okay, so you have to insert this dental mirror over here and you have to bend this like that. You have to insert and you have to bend. Okay, and then you have to retract this, holding the cheek fully like that. Not you have to bend this like that. Okay, if you bend this and you have to retract, then there will be injury and it will cause a severe pain. Okay, just একটু সাইডে চলে যাও, যারা সামনে। Okay, ঠিক আছে? It's very simple. Try to observe by your knowledge, then you could understand. So you have to retract the cheek full like that. Okay, not like this. Then there will be wrinkle formation, looks like headache, or there will be traumatic injury. You understand? You have to retract these things fully like that, not like this one. So you could understand there is a bending, okay, and it will create a wrinkle. Yeah. Okay, and there will be chance of injury there. Okay, that is the retraction technique. Clear?
Yes, sir.
Retraction of the cheek fully by dental mirror. Okay?
Yes, sir.
Whatever. Then you could retract the lip by this. You could retract. You could retract that lip. You should not count the front. Okay. You have to retract the lip. How we insert the mirror? Like this way. Then we touch here and it's I bend it. Okay. Then we just bring it in front. And if you retract this like that way, then it will automatically slip. So that's why when you retract the lip, when you try to retract your fourth finger, that's the fourth finger, okay, you have to give support here so that you hold this, now it will not be slip. Okay, so you have to hold this and you have to retract. And during retraction, the mirror end, that is the end of the mirror. Okay, so that is the end of the mirror. So during retraction, you should not touch the gingiva by the dental mirror. Okay, if you touch here like I am touching here, okay, it will create severe pain on the gingiva. Do you understand? You should not touch. Like you do the scaling and your terminal end of the mirror is just touching over the gingiva. It will create severe pain. So you should not touch the terminal end of the gingiva. Okay, always you have to retract like this. Okay, there is a gap. That is the terminal end. You have to retract like this, and not like that. Okay, it will create severe pain. Okay, at the same time, in case of upper, you should retract in whole amount. Okay, not like that way. Now it is just touching over the gingiva, and it will create severe pain. Is that painful? Okay, so much pain. Okay, so you have to retract this like that way. If you want to retract the mirror by mirror, then you have to retract like this. Clear? Okay, so you have to retract this thing like that. Okay, so retraction of the lip and cheek, I think you could understand.
Yes, sir.
So how could you retract the tongue? You could retract the tongue by this. You have to hold this mirror lingually, and this side is towards the tooth and opposite side towards the tongue. Okay, and just try to touch lingually.